Welcome to the training titled Organic Livestock Healthcare Practices. Here we will take a look at livestock healthcare practices specific to certified organic ruminant producers. The Organic Livestock Healthcare Practices course teaches certified operations the requirements in the NOP standards for organic livestock with a focus on ruminant animals. This includes allowed and restricted materials, preventative practices, physical alterations, prohibited practices, parasite management, and euthanasia. We will identify record-keeping requirements to maintain compliance with the rules and to be prepared for inspection and audit. At section 205-238, we see preventative practices listed, physical alterations allowed and not allowed, administration of vaccines, lameness monitoring, prohibited and restrictive treatments with parasiticides, and many other stipulations of the livestock healthcare standards. As we work through this training, we will digest parts of the standard and provide some examples. You are encouraged to read the entirety of this section of the NOP standards. Here we see the description that physical alterations are allowed for identification purposes or the safety of the animal. This standard also notes physical alteration practices must minimize stress and pain for the animal. It is prohibited in organic cattle to conduct tail docking, wattling, or face branding. We also see where withholding treatments of restricted or prohibited medications is not allowed to maintain the organic status of the animal. If animals are treated with prohibited materials, such as antibiotics, the animals must be identified and not be sold, labeled, or represented as organically produced. Also noted in subsection 8 is the requirement that pain drugs and even euthanasia may not be withheld in cases where it is needed. There are further rules on prohibited methods of euthanizing described in the standards and also covered in this training. As noted on the previous slide, treatment with a substance not listed in 205603 or prohibited under 205604 may not be sold, labeled, or represented as organic. Some, some medications are allowed with restrictions. Be sure to keep detailed records with start and stop periods for administering medications with a required withdrawal period. In the case of dairy animals, the milk from some allowed synthetics must be diverted from organic sales during the withdrawal period, but may be fed to calves of the same operation. Slaughter stock. It is important to note that for some allowed synthetic parasiticides, once administered, you must change the animal's status to organic slaughter ineligible. This means that they can be used for milking after the withdrawal period and breeding. If they're not treated during the last third of gestation, the offspring is considered organic, but they cannot be slaughtered as organic. As you can see, there are very strict rules around the use of medications, and a thorough review of 205603 is necessary in making decisions. More details are described on the following slides. Preventative practices are strategies that include veterinary biologics, pasture management, clean cultural practices in housing, and utilizing species suitable to your conditions. Examples of preventative practices for parasites, as listed in the standards: minimize internal parasites through pasture management, fecal monitoring, and emergency measures in the event of a parasite outbreak. This slide references 205603 again, which lists allowed materials. We will be digging into this section of the standards with examples on the following slides. Under 205603, it is important to understand healthcare materials that are approved or restricted. Further, understanding those withdrawal times and how they relate to the inspection and review process and a producer's record-keeping practices. The example on this slide describes 2 synthetic parasiticides allowed with restrictions. Animals treated with the parasiticides listed above may not be slaughtered as organic, but may continue to produce milk and produce offspring as long as treatment wasn't done during the last third of gestation. Other restricted materials require longer milk or meat withdrawal periods, but the animals may retain organic slaughter status in some cases. This is why it is important to know which materials you or your veterinarian are using, listing them on your approved materials list, and documenting the administration in detail so proper withdrawal times can be confirmed during your inspection. Animals treated with prohibited materials may not produce milk or be slaughtered as organic and are often sold or removed from the herd. These animals can be used as breeder stock in the future as long as all other organic management practices are being met. Thoroughly review the materials listed in 205603 as part of this training to begin becoming familiar with the use and restrictions of these allowed synthetic materials, as well as all other materials on the list. This slide lists prohibited methods of euthanasia and clarifies the written plan needed for humane euthanasia as a component of your OSP. If you have a third-party animal welfare program you are a part of, review their requirements and utilize those practices in developing this section of your OSP. As with all organic practices, be sure to record all euthanasia events by date, ID, and method, and the reason. Let's talk a bit about record keeping for healthcare practices. Keep all purchase receipts for healthcare inputs or materials, whether you've purchased them directly or they were provided by a veterinarian. You may use computer software for animal tracking or a logbook with written entries. Either way, be sure to record all healthcare input applications. This includes recording the individual animal ID, date, the input administered, the reason, and any status changes or withdrawal times required. Be sure to keep conventional sales records if animals are removed from organic status and sold from the herd. Let's look at a scenario that may occur at your annual inspection. During inspection, the inspector is reviewing your cow treatment book. They notice cow number 3290 was treated with moxidectin on 4/13/24. That is the only notation you made for this animal: the date, ID number, and medication used. The inspector notes deficiencies in your records during the exit interview as compliance concerns. Was there documented withholding of the milk for 2 days following treatment, where it was not sold or represented as organic, but may be fed to calves in your operation? Was cow number 3290 identified as no longer slaughter eligible as organic in your records? Was the cow pregnant? And if so, at what stage of gestation? How was this recorded, and did it affect any of the offspring? Was moxidectin on your approved materials list? All these factors should be considered and be a part of your record-keeping system. Let's look at another scenario where your practices have changed and you will need to update your OSP. As part of your animal welfare program, you are now required to use the painkiller lidocaine for disbudding calves. You will need to update your OSP or organic system plan with your certifier. Provide the brand name of the lidocaine to your certifier for approval prior to use. This may include the label. Make sure the physical alteration method, disbudding, also indicates the use of painkillers in the procedure in your OSP. Record which animals are treated to ensure the withdrawal period is met. Describe the method of disbudding, the target age of treatment, and method that lidocaine will be administered. Thank you for participating in this training. I hope you've learned quite a bit about organic livestock healthcare requirements and record keeping.